Hello, Diaz here, founder and owner of Greenwood Dental. Thank you so much for joining me for another video today. Today, I would like to talk about taking records. We get a lot of pushback every single day from patients about or regarding taking x-rays and taking data, collecting data in order for us to place them in the right treatment that the mouth needs. Now, the public needs to understand that there's a difference between what you want and what you need, or what your mouth needs. So the most common phrase that we get, especially as a new patient, not an established patient, is, "I just need a cleaning." Now, a cleaning is a very common term for cleaning up whatever's in the mouth. However, unfortunately, clinically, scientifically, and professionally, it really doesn't mean anything to us. So in order to achieve your goal when you come in to get you cleanings, we have to, unfortunately for you, we have to go through many steps in order for us to classify you for the right cleaning. There are many types. A couple of things needs to happen before we get to the final classification of what kind of cleaning you need. First of all, we need to take x-rays. X-rays are very important. We're getting a lot of pushback lately about x-rays. I just had them 6 months ago. I just had them a year ago from another dentist, which is fine. If they're transferred to us, then those are very important and significant diagnostic tools. But if they're not transferred to us, there's no way for us to diagnose or see through. So a couple of things we need to see through. We need to see through the root. We need to see through the crown of the tooth. We need to see through the bone. Unfortunately, we don't have x-ray vision. I wish I did, but we don't. So the only tool that would help us see through the crown, the root, and the bone level is an x-ray. Now, remember, an x-ray is a two-plane image. It's not a 3D image, it's a 2D image. So it's very flat. Things can overlap each other, and sometimes it will be misleading. So if we're in doubt, we'll ask for a CT scan or a 3D imaging. But the x-rays are very important. Remember, we are a diagnostic profession. We diagnose every single hour on the hour. So for you to say that I just want a cleaning, and for somebody that's a stranger, we don't know who it is, I have no idea what the condition of your mouth is in, so I cannot classify you. Do you need a surface cleaning? Do you need a deep cleaning? Do you need a cleaning every 3 months, 4 months, 6 months? How's the health of the bone? How's the health of the gum, and so forth and so on. So that's why x-rays are really important, because we are trained to diagnose with x-ray. We are trained to recommend treatment and explain condition after looking at x-ray. But without looking at anything, getting a cleaning is like going to get a haircut. It doesn't matter whether it's long, whether it's short, whether it's curly, whether it's straight, whether it's coarse, whether it's fine, whether it's thin, whether it's thick. It doesn't matter. A haircut is a haircut. But also, we are, like me, I'm very sensitive to my haircut. So I go all the way to Boston to get my haircut, because she knows the texture, she knows where the curls are, she knows where to cut more or cut less. But she had to spend time with me in order to understand that over and over again. I cannot just treat the tooth and see if I get the right results. I need the diagnostic tool because there's a liability behind it. I need a diagnostic tools in order for me to touch the tooth. I can't be like a hairdresser to, cut here, cut there, and then learn as I go. You can't. You are cutting a live body tissue. So if you guys would do anything for us, do us a favor and just be a little bit more cooperative and understanding. And I hope this video will clarify why x-rays are really important. So we love you guys. Be safe. I'll catch you in the next video, and DS out.